Needed Z's if you're sleeping next to someone with sleep apnea, nasal congestion, even sinusitis. Thankfully, though, there are solutions. Joining us now is Dr. Akash Anand with GNO Snoring and Sinus. So thank you so much for joining us today.
Thank you for having me.
And you were telling me earlier before the cameras rolling, everybody snores.
Everybody
We just
snores.
don't like to admit it.
That's right.
Right? Okay.
That's right.
But more importantly, let's talk about sleep apnea, because that's
Sure.
more major than just your basic snoring, right?
That's right. You know, sleep apnea is basically difficulty sleeping at night. In a sense, what happens is your throat will close off at a certain point and you struggle to breathe. You can see over there that that's the natural route for air to flow, essentially. It comes in through the mouth and
Right.
through the nose. So for most of us, that tends to occur. But in certain people, they just stop breathing, and that's
That
sleep apnea.
sounds scary.
It can be. What happens is your oxygen level will drop at night, and so those patients will routinely wake up tired in the morning, and they're fatigued throughout the day. So those are the telltale signs and symptoms a patient wakes up exhausted, even after 6 to 8 hours of sleep.
Right.
And so ultimately what we notice is that when a patient snores, the airway starts to collapse, and you can see that in the middle shot over there. It's called a partial obstruction, and that's snoring, which everybody does, of course.
Right. I don't like to admit it, though, you know, come on.
No, it's a best kept secret.
Everyone but me snores.
There you go.
Right. Okay. So how is sleep apnea diagnosed?
You know, a sleep study is kind of the key. Now, traditionally, most of these studies were performed in a hospital setting. Nowadays, we do home sleep studies. And these are actually a game changer because what they do is they reflect your sleep in your natural environment of your own house. You're not hooked up to all these peripherals.
Right. So how has sleep apnea traditionally been treated then, besides just, you know, going to the hospitals? Is there anything that we can add to that?
Sure. You know, weight loss is the key because unfortunately, as we've noticed, as we've gained weight over the past 10, 20 years as a population, there's been a significant increase in sleep apnea.
And as we get older.
Bingo, as we get older too.
Right?
There are certain things you just can't control. Now, absent of weight loss, CPAP, continuous positive airway pressure, is the mainstay of treatment. And we have two machines here, of course, today. These are face masks. Now, at first look, they don't seem like the most sexy option, the most appealing option for treatment, of course. But this is the gold standard for treatment. But for patients that really can't tolerate these options, there are other options available to them as well.
Okay. Can you kind of just maybe explain to me how these are set up?
So this is a nasal mask right here. And so ultimately, this is a tube which actually connects to the machine itself, and it delivers a stream of pressure, and it goes through the nose, and then it physically stents open your airway, so that obstruction cannot occur.
So it's forcing you to breathe.
Bingo. In a sense, it's providing a nice patent airway. And to be honest, for patients that can tolerate this, and this is just a different version, it looks much more aggressive, but the end result is the same. They wake up in the morning refreshed. They love it. And the big problem with these machines, these masks, is that the compliance rate is very low. A lot of patients, for the obvious reasons, just don't want to introduce this into the bedroom. And so ultimately, that's where other alternatives can come in too. You can do treatments, you can do office procedures, for instance, and these can provide a significant degree of relief as well.
Okay. So back with the masks, though, I mean, is this just a vanity thing? Is that why people don't want to use these? Or is it just because you toss and turn and your face?
That's a great question. You know, ultimately, they can be difficult to, adjust to. Depending on how high the pressure is. For instance, if a patient is significantly obese, they may require a lot of pressure. For a patient that is not, and it's mainly because of big tonsils, for instance, they may require lower pressure. So the higher the pressure, the more difficult it is. There are patients who are claustrophobic. And to be quite honest, there are some patients that will use these machines and just don't feel relief. So it tends to be one of those three options as to why people don't wear the mask.
Okay. So let's talk about different procedures where you would go into the office. First of all, are they painful? You know,
ultimately, it's like going to the dentist. So there's always a degree of post-operative discomfort, but for most of our procedures, we give ibuprofen. Now, traditionally, surgery has been an option, and then on the other end is this machine, of course. We have different options that we perform in the office. And ultimately what we do is we essentially look for a patient's airway. You can see on the monitor, the left image shows a patient in the sinus region totally blocked. This individual had mild sleep apnea. And then after we did our procedure, on the right, you can see there's a significant opening in that airway. And as a result of that, that individual would breathe better. And actually, in that case, that person had a mild case of sleep apnea, which reverted back to normal breathing at night afterwards.
Oh, wonderful.
So a lot of these procedures can be performed in the office and enhance breathing and sleeping as well.
That's good. I'll take it. I feel like I'm breathing better already just talking to you. Lovely. Well, thank you so much. Appreciate it.
No problem.
Well, to contact GNO Snoring, give them a call at 504-309-8615, or you can check them out on their website. That's gnosnoring.com. And of course, there's much more to come on Great Day after the break, so make sure you stick with us. We'll be back.